going to talk about suicide here, uh, which is a nice follow-up to depression. Certainly not everyone who is depressed is suicidal or complete suicide, but it's a significant risk factor. This is also an issue that many students run into, have experienced personally, either by themselves being suicidal or friends and family being suicidal and talking to them or attempting or completing suicide. It's a confusing topic, and so this can often be a really difficult one to discuss. And if it's difficult for you, please reach out to the people around you, including me. So suicide is the 10th leading cause of death in the US. In 2017, 47,000 people died of suicide. There were almost 1.5 million attempts, and suicide and self-injury costs the US $69 billion. Think about how that would help to balance the budget if we could address that effectively. In terms of people, young adults, it's a second leading cause for both men and women. Women are more likely to attempt suicide, but as you can see here, men are more likely to complete suicide. Almost twice as many as for, as many men as women. Thoughts of suicide occur on a continuum, just as any of the mood disorders that we're talking about, from a will to live to suicide completion, with more people at each of these steps. So more people who want to live than people with thoughts of death, and more with thoughts of death than thoughts of suicide, and more with thoughts of suicide than actually planning it or attempting or completing. And I think that that's an important thing for us to keep in mind here, that on the one hand, we want to be empathic with our friends and family who are thinking about suicide. And on the other hand, we need to remember that suicide is not inevitable, even when people are talking about it. So suicide is a biopsychosocial. We can think about it in terms of biopsychosocial issues, that we certainly have mood disorders that impact it, and other kinds of issues that put people at risk, but also psychological issues, self-esteem, self-control, impulsivity, and healthy life habits, as well as social issues. Things like religion can protect people from suicide. Culture, different races have different rates of suicide. So whites are much more frequently completing suicide than African Americans, although Native Americans have the highest risk of suicide. Peer groups, suicide can be sort of contagious, as people either gain or lose feelings of support and become more hope or experience more hopelessness. Losing work, losing or having difficulty paying bills can increase stressors and put people at risk. As we're predicting suicide, there are a number of things that put people at risk. including a recent loss or shaming event, losing a job, losing an important relationship. Having a history of previous suicide attempts increases risk rather than decreasing it. And I think often we believe that it's going to decrease completing. Having a family history of suicide, of completed suicides, puts us at greater risk, as does impulsivity. When I have an impulsive client, that makes me scared. When people are talking about using a lethal method of killing themselves, such as guns, hanging, that increases my blood pressure, as does drug and alcohol use. And the same for having a low level of social support. You know, if you feel supported by friends, family, even a therapist, that can make a significant difference. When a friend is suicidal, don't debate the value of life. Don't debate whether this is an important kind or a useful strategy. Don't minimize their problems. Don't give advice. And certainly don't leave them alone. But there are things you can do. You can take your family member or your friend seriously. Listen attentively and empathically, expressing your concern and caring feelings. Acknowledge their feelings. Ask direct questions about their suicidality. It's okay to say, you know, you've been really quiet today, and I'm wondering if you're feeling more suicidal. That's not going to put any ideas in their head. If they indicate that they're feeling suicidal, ask them whether it's okay to, you know, for you to have their means of suicide. You know, so I will ask for, you know, my friends' pills or guns. Now, I don't think you should be taking them without their permission. You want to help them feel like they're in control, that they are being heard and listened to, and help them get help. There are a lot of good places to get help, whether that's friends, family, or therapist, but it also could be the National Suicide Prevention Lifeline. You could suggest that they text talk to 741-841 to text with a crisis counselor 24/7 throughout the day and week. Or you could walk them to their therapist's office, the University Counseling Center, or the emergency room. So let's think about these ideas in terms of the critical thinking model. I think part of what we want to do is be empathic. And so that means listening to other people and recognizing their values. And that helps you to recognize some of the things that put them at risk in terms of suicide. You want to think critically about claims about influences. So people may feel like things will never be different. That doesn't mean that they won't be different. And so, you know, you want to help them and help yourself recognize that things go up. You know, they may be experiencing greater suicidality right now, but at other points they will go down and they'll experience lesser suicidality. You want to recognize and appreciate the roles of context and culture. Things like shaming events. What kinds of things are putting people at risk? You know, if you're working in a school and somebody else has attempted suicide, recognize that everyone is likely to require more support during this period, as it may increase their feelings of hopelessness. And rather than only being up here, You want to put it into action. You know, make sure that you are listening to people, that you are reaching out, and that you're behaving in a sensitive and ethical way. And take care. I'll see you in our next chapter, which is the one on positive psychology. Take care. Bye-bye.